Okay, good morning, everyone. Welcome to the first session of Pleyda Health webinar. Please, can anybody confirm if I am quite very audible, please? Please, can you all hear me?
Yes,
Yeah,
ma'am, we can hear you.
Okay, thank you. Once again, welcome to the first session of Pleyda Health webinar. This session is brought to you by Pleyda Youth Enlightenment Forum, and this is in an effort to celebrate our 10 years anniversary, 10 years of excellence, 10 years of creating impact in our community, 10 years of ensuring that productivity remains our watchword. And I would like to use this medium to invite the president of the association, Ambassador Mustafa Akinola, to give an introduction of the club to our guests. Ambassador Mustafa Mujtaba Akinola, please.
Okay, good day, everyone. Good morning, everybody. My name, as introduced, Ambassador Mujtaba Akiola, and on behalf of the executive and members of Pleyda Youth Enlightenment Forum, I want to welcome you all to our first session on health webinar series organized by Pleyda Youth Enlightenment Forum as part of our 10 years anniversary celebration. We are truly pleased to have you all join us this morning. Firstly, Pleyda Youth Enlightenment Forum is an organization established in 2016. It started with the name Youth Impact Club, and after registration, we had to get this name Pleyda Youth Enlightenment Forum. And we started with a very clear vision to assist young people in discovering their hidden potential, developing valuable skill, and building the character required to become future leaders. Over the years, we've remained committed to raising youth who are equipped not only with competence but also with sound moral value and a strong sense of responsibility to the society. Our mission is straight to build youth with necessary skills and understanding to become better individuals and making meaningful contribution to their communities. We do this through our weekly mentorship program, leadership training, enlightenment programs, capacity building initiative that address real issues affecting the young ones. Today's session, as we know, is focused on mental health. Mental health is a subject that is often overlooked despite the pressure and expectations many young people face daily. At Pleyda, we believe that leadership and productivity begins with a clear mind, and this webinar is therefore one of our home way to ensure that youth get what they want. And we are pleased to have with us today Dr. Rahmat Folashade. She's a medical doctor and a trauma-informed counselor. She's going to be our facilitator for today's program. We certainly appreciate her for accepting our invitation and for her willingness to guide us through this conversation. And to all our participants, whether you are a member of Pleyda, whether you are one of those people who join our webinar, or probably whether this is your first time joining us, I say thank you so much for coming, and I hope you guys enjoy the session. I want to advise that we encourage and engage actively so that we can get the best out of this. Thank you so much for being part of this session. I wish you all a thoughtful and impactful session. I am Mustafa Kela, President Leader Development Forum. Thank you.
Thank you for the wonderful introduction, as said by the president of Pleyda Youth Enlightenment Forum. We are concerned with youth development, and this is one of the several efforts we have engaged in over the years trying to create impact in our community. And that brings us to the topic of this very webinar. Recently, I have a conversation with a younger brother of mine who just concluded his JAMB. And somehow, while discussing, it was like, oh, few months ago, he was bothered about his WAEC. He was concerned about ensuring that he passed his papers, he made his papers in one sitting. And now the WAEC has been done. Next is JAM. He's now getting bothered about whole admission procedure. which school, what course, and somehow I made him understand that such is life. By the time the admission clicks and then you eventually gain admission to any of your preferred institution, you would realize that you would start getting bothered about something else. It wouldn't be your WAEC again, it wouldn't be your JAMB again, it would probably be you trying to ensure that you have a perfect CGPA through your stay on campus. And then that brings me to this very popular pidgin saying that we all know, that problem no dey finish. For every stage of our life, we have different things, different challenges that we are facing. But then in the midst of all these challenges, it comes with a whole lot of pressure. It comes with a whole lot of challenges, academic pressure, societal influence, peer pressure, and so many things like that. How well are we trying to take care of our mental health? How well are we preparing ourselves to ensure that we are able to handle carefully whatever challenges that it is that life has thrown at us? And then that brings us to the fact that we understand that it is quite very important to discuss a topic as crucial as this. And for this, we invited an erudite scholar, someone who is well equipped with the right knowledge and skill. She is a medical doctor, a trauma informed counselor. She is passionate about mental health and has helped countless women through emotional and mental overwhelm. Through her work on social media, she encourages safe discourses that advocate for mental health awareness and support for women community. Kindly join me to welcome Dr. Rahmat Folashade Omole. Welcome, ma. You have the floor, ma.
Thank you so much. Please confirm if you can hear me.
Yes, we can.
Okay, thank you so much. First of all, good morning, everyone. I'd like to say a big thank you for the invite to speak. I'm always quite excited to host sessions like these, to have discussions like these around mental health. And it makes me so happy that a lot of us are now being more intentional about pursuing our mental wellness. So, without further ado, I will get straight into the session. Um, First, I want to say a big thank you to Pleyda. This is a very beautiful initiative, and I pray that we get immense benefit from it. I pray that you're able to do even more. I'm so excited that this is your 10th year and you are doing so well. Um, so now that we are speaking about mental wellness, and there are different ways that I could approach this, but I'm going to use experiences. I'm going to approach this from my experience as a medical doctor, not as the medical doctor, the practitioner, but as the medical doctor that was once a medical student. And this is because Pleyda basically seeks to, inspire youths to do more, to create positive impact in the society, to get you to see beyond where you are, creating possibilities for yourself and the society. This means that Pleyda basically hopes to inspire high achievers. He hopes to make high achievers out of youth. And there is no better. Can we please mute our mics? Yes, thank you. So there is no better, how do I put this? There's no better case study to use in this regard than a group of medical students in medical school. So I'm going to be citing key examples of when I was in medical school that I want to share to enlighten us on how mental wellness can hinder us from being that overachiever, that high achiever that gets to make beautiful impacts in the society. Institutes like Pleyda are there to inspire you, equip you with the skills that you need to get to high positions, to create beautiful things in the society, like I mentioned earlier. But when you don't take care of your mental health, it becomes an hindrance. So at the end of the day, you have these beautiful dreams. You want to do so many things, but then your mental well being is poor. And so you cannot achieve that. When I was in year three, I was advised to drop out of medical school by my doctor. my physician at the time, he told me that his medical advice would be that I should drop out of medical school, probably take a year. So maybe not drop out per se, but take a year off and then come back, because he believed that my mental health was in jeopardy and he did not see getting better in that environment. So many people will tell you. I want to us all in the comment section to please write the sector we are currently in, or the what's the called? I don't know the department. If you are in university, write the department that you are in. Is it what's it called? Law, medicine, agriculture, whatever it is that you're currently studying. Please put it in the comment section. I want to have a good grasp of those that are here with us. Even if you're already working, if you're already out of school, let us know the discipline that you currently engage in. So, as I was saying, a lot of people will tell you to, do better. They will give you all these skills. Yes, economics, public health. Thank you. Social development, sciences, translation and business development. Thank you so much. These are high tension courses. These are courses that will demand you to give in your all. I tell people all the time, whether you're going in to study medicine or architecture or agriculture, whatever field you are going into, you are expected to show a certain level of excellence. You are expected to show a certain level of discipline in order to attain the grades that you want, the certification that you are going after. And all of these can be highly demanding. People will tell you that if you study well, you get good grades, and that is all. They will not tell you the hidden stressors behind these things. They will not tell you that there are times that you want to quit. I want us all to indicate in the comment section if you have ever at any point in time in your academic journey felt like, I want to quit this thing, it's too much for me. Or if you have ever felt like, Paloromi Shebai, who sent me? Oh, who sent me? Do you get? Has there ever been a time in your journey where you felt so frustrated, like, I don't know that I can do this anymore? I told my dad, I can't do this anymore. I don't think this is for me. The first day of medical school, the first day. So it's not as unique, or it's not as isolated as we think. But when we are in these situations, we tend to believe that, oh, this is only me. Someone said, sister Aisha said, writing ICANN exams. I wanted to quit my job last week. I can so relate to this. I can so relate. But unfortunately, as widespread as these thoughts are, we don't talk about them enough. Everybody talks about money and making money and getting that promotion, but we don't have enough discourses around what these journeys take from us. And quite a number of people are actually quite ignorant of what it actually takes from them. So you don't even know to discuss it because you are not aware of it. A lot of us have been tagged as cranky. Okorani, if you are Yoruba, you understand what I am saying. But that's basically saying you're cranky. Omoye Koragon, or she's so lazy, she's always sleeping. So many of us have normalized symptoms of what are mental illnesses. Now, let me say this before I go ahead. When we say mental illness, it comes in varying shapes and form. I was talking to someone yesterday and they spoke about insomnia, how they're having trouble sleeping. They probably sleep for maybe 3 hours a night and they can't sleep during the day, maybe. And they were saying they don't want to call it insomnia because then they just believe that insomnia is much more, it's more serious than only being able to sleep for a couple of hours. And I corrected the person. I told them, just because you have a mild version of something doesn't mean you don't have it. That you can there are things that you will say and will tell you as medical practitioners, oh, this is not the case. You don't have this illness. But most likely you have a mild version of it. There are people that will come and will tell them you have the illness. This is the mild version of it. If you don't take care of it well enough, it can evolve into other severe versions. But a lot of us treat our symptoms as isolated cases. I have a headache, you use paracetamol. I have backache, you use, paracetamol again. Isolated incidences. When people present to us, especially in the mental wellness space, when they present to us, they have ignored a lot of their symptoms because they treated them as isolated cases. And now they are presenting in severe forms that either have maybe no treatment or have very poor prognosis, which means that they probably won't get better as well as fast or even at all as if they had presented earlier. So all of these things are why it is very important for us to take our mental wellness seriously, and why Pleyda has thought to come up with this initiative, that we should have these discussions. So I'll be highlighting core points and then referring to certain stories, like I said earlier on, from my journey, you know, into being intentional. I wasn't always intentional about mental health. I was the kind of person that, first daughter, well, one of two, but first daughter, African child. I'm saying African. This is important because at the time when I was becoming aware of mental health, I wasn't in Nigeria at the time. And I genuinely believe that only white people had, issues with mental health. People that were welfare, it's only those that are wealthy that have obesity issues. It's not like that. You understand? But that was my thinking at the time. That was the misconception that I had. I just feel like I was this strong African child, dedicated to studying. I have my passion. I know where I'm from. Like, why would I be having issues like these? So even when my symptoms were brought to me, when I was faced with them, when I was given proper diagnosis with anxiety and depression, I looked at my psychologist like, it's not me you're talking to. Like, this woman doesn't know what she's doing. And I waved everything aside. And unfortunately for me, what would have taken maybe 6 months maximum of proper care and attention to get over, I spent years battling with. I was eventually placed on medication and I had really, really, really severe episodes. So I don't want other people to have to go through that. You are bright people, you are intelligent people, and you want to do better, you want to do more, you have so much within you. That's why you are in spaces like this, that's why you're joining conversations like this. You deserve everything that you need to get to the top that you see yourself occupying. But when you don't take care of your health, you're not able to do that. A lot of people that are on their sick beds mentally, because of all the things that they know that they could be doing if they were not on this sick bed, watching other people live the life that you dream of, that you want for yourself, but you can't because you're just in this position that you seemingly have no control over. So the only thing that we ourselves, which is what we are doing right now, is to equip ourselves with the skills that we need to ensure that our mental health is always, 100%, or at the very least, just occupying the higher percentile of well being. So, in this light, I'm going to ask. I'm really sorry. My niece is here and she wants to contribute. So please, you'll be hearing our voice from time to time. In the meantime, please write in the comment section if this is your first mental wellness conversation you're joining online, especially with other people. Please indicate in the comment section. Now, while you do that, let's look into how can you tell. We've spoken about mental health, mental illnesses and mental wellness, and why it's important that you are up to task, that you are on top of your game. How can you recognize the early warning signs of mental health challenges before they become severe? Because we aim to catch them young, as with all health issues. We aim to catch them young. If we can catch them really early, like I was saying in my own case, it will probably just take a couple of months, maybe even weeks or days to counter instead of letting it deteriorate. So, what are the early signs? Depending on the mental health condition we are talking about, the symptoms can vary. But let's start with one of the most common ones, which are mood disorders, like depression, like maniac disorders, like schizophrenia. Those are quite common ones, even though they are not well spoken about. A lot of us confuse sadness with depression, but sadness is not depression, and you don't even have to be sad per se to be depressed. So sadness can be on and off. Sadness can come and go. But with depression, if sadness is a symptom of depression in any patient's case, you have at least 2 weeks persistently where the person is just sad for 2 weeks straight. They're just sad. Another very common symptom across board, by the way, for mental illnesses is so very low moods. So, like we spoke about sadness, very low mood. It might not be sadness, it might just be melancholy, or you're just very down. For some people, it's very hyper moods. There are some people, our society, but we give everybody names. Some people, you meet them in the hostels, you meet them in your offices, they're just weird. There's just something about them that makes you go, this person is just very weird. Or you have names for them in Yoruba, Jawe Jura, so many names that we give these people, but they're actually mental. There are medical terminologies that we give them, if in cases like these, they are diagnosed to have mental conditions. So when you are very hyper, um, you have low mood, you feel detached. These are more common now. I'm being particular, like I said, with people like you that want to achieve great things in the society, like I'm assuming we all here want to do. So you lose interest in everything. This is another one that is common when you have mental illness as a person that you know is a high achiever. You lose interest in everything that you typically are interested in. As a medical student, we are in where I studied anyway, we were opportuned to participate in in surgeries, trauma care, anything that has to do with very hands-on practice. Medical students were highly encouraged to participate in them. Now, because this is something that was meant for the professionals, those that graduated and were practicing, we were always very eager to participate in them. It was like once in a lifetime opportunity. You get to see this surgeon perform, you get to assist in this surgery. There was a time in my medical school journey, in one of the heights of my mental wellness issues, they called us all. We were in the hostel, and they suddenly let us know that there was a major accident at an intersection. Okay. And over 20 people were involved in the accident. They needed all hands on deck. Normal me, Omoli Rahma, I would be amongst the first to arrive there, if not the first. Like I was in the hostel at the time. I think I had just gotten back from the hospital when, the message was sent in. I would have raced there. Do you know what I did? I just went under my covers and drew the duvet over me. I did not even care at all. I did not care. In that moment, I didn't care who was alive, who was dead, what was going on. I just saw the message and dropped the phone on the table, went straight to bed. I didn't care. This was not about, oh my God, I really wanted to go, but I was tired. I did not care. As professionals, you will reach positions like that if you do not take good care of your wellness, of your health. You will reach states like that where you don't care what happens with your work. It doesn't matter if people are involved, if this is somebody's life, regardless of what it is. You cannot care any less. Another way that you can tell that something is wrong, and so for me in that moment, because I was already in a state where I was keeping tabs on my mental health, I was already being intentional. I knew my triggers. I knew when I was, heading downhill again. I knew that I was in trouble again. I didn't feel anything at all. Not excitement, not that eagerness to serve, nothing at all. So in your case, it could be that maybe they're talking about one assignment. Maybe one lecturer is saying that you will do this, da, 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 da. If you don't do this, you don't give a damn. You cannot care less whether maybe your grades. If you are the kind of person that used to be really, really intentional about scoring good grades, and all of a sudden you don't care whether you get a D or a E, or you don't care about your grades anymore. So this can show up in different ways. But bottom line is you have something you care deeply about, and all of a sudden you no longer care. Now, another thing I forgot to mention when I was explaining in the beginning why it's so important to take care of our mental wellness is how deeply it can affect your relationships as well. A lot of us have issues with our relationships. We cannot keep our relationships afloat. And we just see it as, people will tell us different things. Maybe for Yorubas, they will say, Boya mi olori okoni, or for the men, they will just attach so many things. Maybe you are not meant to have a husband, or you're not meant to have a wife. Maybe she's just badly behaved, or he's just a nuisance. But there are actual issues to this. This particular symptom that I said about losing interest, you can love your partner, you love them with everything you have, you care deeply about your relationship. But when you are in such states of emotional overwhelm, when you are burnt out mentally, you could not care whether they are alive or dead, whether they are present. Like, I'm using those extreme cases so that you see just how it is. And I actually, when I was in school at the time, I actually lost a relationship that was serious enough to lead to marriage because of these issues. This person did not understand what I was going through enough to know that it was not about them. And they just felt I was no longer interested. Because look, truly, if you want to know, if this person, we are meant to be together, or we are supposed to be together, or they care about me, you look at their actions, and then when the actions are not tallying with their words, it doesn't matter how many times you say, oh, I actually care about you. If your actions are showing otherwise, they will take it to be that way. So many women, for example, struggle with mood swings in their relationships, and their partner just says, oh, she has mood swings, for the ones that that they are understanding and considerate. And then for some other people, especially depending on the relationship situation for them, it might mean they just don't care enough about the relationship. They don't care enough to put in efforts. They are probably going through something. They are probably going through something mentally. I mean, there's a lot of strain on them, and that is now affecting their mental well being. So, if you fall in this category, you want to really sit with yourself and look at the other pointers and see if there's a pattern so that you can seek the help that you need. So aside from losing interest in everything entirely, we also have cases of, so say in terms of addiction, for example. Do you know that there are so many people that you are reliant on something? Like, let's say with movies, for example. If you don't watch a movie, you cannot go to sleep at night. If you don't watch a movie, or you don't listen to something, you cannot go about your day properly. With medications or drugs, it is that way. So for some people, it's even coffee. And it's how we normalize these things to the point where we don't see it as a big deal. But it actually affects us mentally as well as physically. All these things that we are addicted to. We majorly place a lot of emphasis on those that do drugs, quote unquote. But there are so many other medications, so many other drugs that we use in places of leisure, in clubs, in parties. They are so normalized now. But it's only when you see people on the streets in very bad conditions that you see it as abnormal. But if you are the kind of professional, the kind of high achiever, the kind of person who you cannot appear in the office, for example, without taking a shot, that's the shot of alcohol or a bottle of alcohol. You cannot go through a full day without taking a bottle of wine. Then you need to look into those things. If you are the kind of person that is always grumpy, if you've not taken something, you need to pay attention. So there are so many other symptoms that we could explore. And at the end of the session, I'll be sending a slide that basically summarizes all these things. But these are just early warning signs. If you're experiencing anything that is recurrent, you need to look into it, including your sleep, your eating pattern. Mental wellness cuts across every aspect of your life as a human being. So, now let's go into the strategies that you can use daily to, manage stress, pressure, and expectations. Because again, we can't say because we know that we'll have. So, for example, for me now, when I was advised to leave medical school, I didn't leave. I stayed through it, and by the grace of God, I completed, the whole thing. How did I do it? For one of the things that made me very serious, very intentional about my mental health in medical school was sitting down and asking myself if I was ready to let go of everything that, mattered to me. So am I saying because, I might be overwhelmed sometimes, because I might have mental health issues, I will not have a family of my own? There were times that I would be so tired, I would be so down, especially when I was having depressive episodes. I wouldn't be able to take care of myself physically. like bathing, brushing, things like that. And then I would ask myself, if I can't do this for me, would I really be able to do this for my children? I even wanted to have 6 children, as at that time, I wanted 6 kids. And so I had to ask myself, does this mean that I would have to let go of everything? They are saying leave medical school. Does that mean I would have to leave my dreams of being a mom, leave my dreams of having a partner, leave my dreams of basically every dream I had? Even as at that time, my life as, a religious person was being affected. So I had to sit with myself and, just be intentional about taking care of myself, because at that point in time, it was not a matter of letting go of my dreams. It was a matter of improving the skills that I currently had. Because at the end of the day, whether you're seeing a psychologist, you're seeing a psychiatrist, aside from medications that you might be given, what we basically do in these sessions is equip you with the skills that you need to keep yourself well as you go about all your normal life activities. So I had to learn. I had to study myself, study other people, and of course, because I was in the medical line, go through books as well. Really just get into the practice, the mental wellness space, to see ways that I could help myself and others. So I'll be sharing some tips that I've learned, and we'll also be exploring how that ties into your life. Okay, so that you know where to implement them. Now, when we talk about mental health, a lot of these issues come from exhaustion, deep exhaustion. One of the common reasons why we have that is with boundaries. So we'll talk about boundary setting right now. Why do we talk about boundary setting? How many times have you said yes? Let me know in the comment section. If you've, or not comment, I keep saying comment section, in the chat box rather. If you have ever been in a position where somebody asks you for something and you cannot say no, it's not convenient for you at all. It is not convenient, but you can't say no. And then you say yes. You already have a lot of things to do. Maybe it's not convenient. It could be a financial request, it could be a physical request, maybe it's your mom, it could be anybody. And you cannot bring yourself to say no. So you keep on saying yes. There are many of us like that in this room. I can't see anybody. Does that mean yes? Yes. So you experience situations where you can't say no even when it's not convenient for you. The more things you add to your list of to do, of things that you want to do, the more overwhelmed that you are. And it doesn't matter whether you're at work, it doesn't matter whether it's at home with people that you love. You just keep on saying yes, yes, yes. And then you get so overwhelmed. You get so overwhelmed with everything, and it starts to affect you. It starts to affect you. So you need to practice saying no. Habib said that he started practicing saying no last year. That's very good. That is such an underrated skill, the art of saying no. I recently told somebody, one thing that I want us to pick today, somebody should please write it in the chat box. No is a complete sentence. No is a complete sentence. Write it in the chat box, please. No is exactly. Thank you. No is a complete sentence. Oh, are you available to do this? No. Are you available to do that? No. Do you have this? No. Find mental gimmicks, mental ways. You understand? Find mental ways to prove to yourself that it is okay. Because sometimes it's not even these people, it is us. We cannot sit with the discomfort of disappointing other people. So we would rather disappoint ourselves. We would rather inconvenience ourselves because we cannot sit with the disappointment. We cannot sit with the discomfort of disappointing other people. But the question is, at what cost? At what cost? So you need to practice saying no. And this cuts across everything, like I said earlier, your finances, your physical presence, your energy, your time. You need to start taking account of where each of that is going to, because these leaks are the things that amount to exhaustion, physically, emotionally, psychologically. It all ties in to one another. So another one that we want to explore again, another tip that I would give is one major way that we have issues with, that we are more prone to, let's say, becoming burnt out or becoming mentally overwhelmed, is when we don't have a purpose for what we are doing. So let's say they told you to go to school, so you went to school. This job is available, so you picked that job and you are just doing the job. But it's not supposed to be like that. When you don't have purpose for what you are doing, when it feels like you just go there and you come back, there's nothing bigger than the physical stress to keep you going. And sometimes it could be that you are burnt out or overwhelmed because you are not getting enough remuneration for what you are doing. If you are currently doing a job, if you are currently maybe employed, self-employed, or employed under someone, please write in the comment section if you feel as though you are being underpaid and overworked. You can write one, like the number one. If you feel as though I am overwhelmed, I am overworked and underpaid. If you feel as though this describes your current situation, please write one. I am currently overworked and underpaid. This is something that we see a lot. And in case you're a student right now, you can look at it in the sense that you're not getting enough money at home. This is a constant struggle for students, especially when you have so much to cover in terms of your academics and you still have to, you know, work on getting support outside of your immediate family because you don't have enough financial support. So if you fall into in this category, as a student, you don't receive enough money from home and you are so stressed about your finances most times. Right one. As a worker, you don't get paid enough. You're overworked, you're underpaid. Write one in the chat box so that you see that it's not just you. And these are things that we face daily that makes us prone to having mental health issues that we undermine because everybody goes through it. You are not the first now. Even those that are moms, those that are parents, those that are spouses, you go through certain things in your marriages, certain things in your parenthood journey, and because it is so normalized, everybody keeps on saying, oh, I went through the same thing now. I went through the same thing, so there is no big deal. And so you refuse to acknowledge the fact that what you are carrying is heavy and you need to really, really take good care of yourself in the times that you are going through that. So with Habib that had to go through, being overworked and underpaid for 2 years, that is a lot to have to deal with. And it causes burnout. So you will see the symptoms that I spoke about. There will be times when you feel so overwhelmed, times when you feel disconnected from the job, times when you even when they are correcting you, you don't care. You don't care at all to improve or change because you don't even feel like you're getting what you deserve in the first place. These are real issues, especially for people who have to put in so much in getting their academic certifications or degrees in the first place, or people who genuinely feel like what they are doing is, it's quite heavy. It's quite heavy, even for entrepreneurs. So another thing is inadequate support. We've spoken about money, not receiving enough financial support. Let's look at those that have businesses or those of us that want to have businesses. Now, if I'm saying these things and you cannot relate, this is still important for you to hear because you might experience it in the future, and being aware of it will help you to mitigate the chances of now having the effects, the side effects, which is the mental health issues. If you already answer, if you know if you are aware of the risk factors, you'll be cognizant of it when you finally start to experience it. And if you do not get to experience it, if you notice any other person in your circle experiencing it, you'll be able to be there for them in the ways that they need you to be there for them because you understand the direct effects that is caused from being in situations like this. So you wonder sometimes, you see people on the streets, you see how they are, you think of, oh my God, what could have caused this? Or may God forbid, it will not be me. But it could be any of us because all of these risk factors are things that any of us can relate with. So those are things that you need to look into, you need to consider. So um let me see. Give me a minute, please. Yes. So now let's look at the cultural and social perceptions that affect mental health awareness and willingness to seek help. How many of us here has ever had somebody tell you, I'm not okay? How many of us here has ever had somebody reach out to you for mental health support? Please indicate if you have ever been in a position where somebody that you genuinely care about, is going through mental health challenges. It doesn't have to be something really over the top, maybe severe forms, but they've reached out to you for support. If you've ever been in this situation, please type 3 in the chat box. So Sir Habib said yes, opposite gender. Thank you, Shukrat Akinola. Thank you, Kendi Oduloye. Thank you, Ajibola Badruddin, and thank you so much. Yes, this is nice. Oh, we have a mental health advocate in the room. Yes, I love that. I love that. So now, as people who have had other people, approach you for help, do you know that for one person, now you are aware that, okay, somebody has come to you. For one of you that was approached, many other people would have been approached for help as well. Do you know that depending on your reaction when they tell you these things, depending on how you are able to support them or not, it really affects, their willingness to seek help next time. And it really just, it changes the way that they see mental health. How do I mean? What do I mean? A book is a book until we give it a name. Anybody can pick up a book until we give it a name. If we put a book on a table, for example, and we say people should approach it, anybody can approach it and it's fine. But when you call the book bad, or when you look at the book in a particular way, or you ascribe a particular name to that book, then nobody wants to even admit that they know about the book. Nobody wants to go near the book. Nobody wants to admit that they've seen the book, they've read the book, they've touched the book. Nobody wants nothing to do with the book. And that is how it is with the society as well and our cultural norms around, mental wellness. A lot of times people do not want to seek help because of what other people will say about them. Because what they've listened to other people say has already given them a particular perception about mental health. The first time I visited a psychiatrist in the clinic, I'm a medical student, so I was able to see them outside of the clinic. But the first time I had to actually go to the mental health clinic, I was shaking from head to toe. And I felt so, oh my God, oh my goodness, I felt so out of this world. I felt so bad. Let me put it that way. I felt like I was entering a different realm entirely. This place that is meant for people who are mad, quote unquote. This place where mad people are kept. I felt so alone. I felt so. It was a very, very humbling experience, simply put. But now that I've been honest with you, okay, now that I've been honest with you about what the experience was like for me stepping in that day, let me tell you, what I saw that day that made it easier for me to bear. And I hope that it really, really changes a lot of our minds and you can help speak to others outside of this session about it as well, so that they can also see. That day when I finally sat down after registering and I sat down, mind you, I was here for anxiety and depression. I sat down, feeling all the type of way that I was saying, shaking, just feeling so bad and feeling like, God, is this my life right now? I'm in this placement for mad people. I was a medical student, by the way, so that you can see that ignorance is not rooted in where you are sometimes. Sometimes ignorance is just ignorance. It doesn't matter your level of education. It doesn't matter how wealthy you are. It does not matter. If what you don't know, you simply do not know. And it is our responsibility to get to know what we don't know. Now, that's why I'm so happy to have us here today. So I was saying, seated there, the one thing I saw that really made me just calm down and made me feel like, okay, this is just another regular hospital. I saw I think the baby could not have been more than 7 months, like maybe a 7, 8 month old baby. in that space, also waiting to see the psychiatrist. I saw a 2 year old that day as well. I saw very old people. I saw pregnant women. I saw people who looked like their social standing was low. I saw people who looked really, well put together, like they came from money. And I realized that this is not an isolated thing. If this little boy, this little baby that doesn't know anything, if it can be in this space, this is not about me, basically. This is beyond me. This is bigger than me. And I think that a lot of us need to really imbibe that thinking where it's like, this is not about me. The minute you stop personalizing what you are going through, it becomes easier for you to address. It becomes easier for you to face and deal with. It's not your depression. It's not this my anxiety issues. No, you struggle with anxiety issues. You are you. You are an individual, and then you struggle with this. You are not that thing. This is a very important distinction to make, because it would make it easier for you to seek help. It would make it easier for you to treat these things without shame. Okay? So in that regard, I felt so much at peace being there, not because all the things I had heard about being there had suddenly changed, or because I now knew better from just seeing this is a medical condition like any other. It has its unique traits, especially in the sense that before people know about mental health, they would have had misconceptions about mental health. It was like when HIV and AIDS first, was known to Africans or even over the world in general. Before we started having seminars and programs and having people really sit with what it meant. A lot of us used to think that once you talk to somebody with HIV and AIDS, you have it too. You know, once you sit with them, you have it too. So many misconceptions like that, but more people know better now, and it's only because we started to destigmatize it. So as a society, when we start to learn, and when I say learning, I'm not just saying pick up a book, because before I was diagnosed, I had sat in classes, I had taken psychology classes and done exceedingly well. And all of a sudden I was experiencing this thing, and I knew nothing about it. So when I say educate yourselves, I mean watch docu-series. That's documentaries that are in series form. Doesn't even have to be in series, just documentaries basically. Listen to people who are experiencing these things talk. Understand the fact that it can happen to anybody, and because all the things that we go through are very generalized. That's why I keep on saying, write in the chat box if this, write in the chat box if that, because you need to see that you are not alone in these struggles. These are things that everybody goes through. As long as you are walking a similar path, you will have similar struggles. And unfortunately, if you are not in a space where you are prepared and aware, you will not be able to handle these things well. So educate yourselves properly by watching series or documentaries where people who have experienced these things are talking, where they are sharing their experiences. Read, listen to doctors, medical doctors speak about these things. Let them educate you on what to do, how to handle situations. Some of you, people will approach you and talk to you, and because of you, they will get off the ledge, off the psychological ledge that they were on, meaning they would have committed suicide if not for you. And some of you, people will approach you and talk to you, and because of your inability to hold that conversation safely, they will be pushed off the ledge. Your conversation might be the final straw that gets somebody off the ledge. And right now we talk about suicide, and we see it as, oh, the highest form of what mental illness that is not taken care of can take. But it's not like that. We have schizophrenia. I once had a senior in medical school, brilliant lady, beautiful inside and out, well spoken, well read, well meaning. She would give hugs like they were candy. Very, very pleasant lady. And all of a sudden, she started to exhibit symptoms of schizophrenia. She was deported back to Nigeria in shackles. Shackles. Somebody's daughter. We did not hear until after all of these symptoms began to manifest, and the international student body had to stand up, and we really had to, reach out to our family members. That was when we heard, or that was when we found out that she had lost not one, not two, not three, not four, but five of our immediate family members that session, that academic session, one after the other. She lost family members, her siblings, her parents, not at a go, one after the other in succession. Her finances were in jeopardy, so she probably didn't even know where her tuition would be coming from. And then she could not travel to Nigeria to attend the burials because we are Muslims, and we bury immediately. She was not in the country. Who would even pay for her flight? And she was dealing with all of these things with a smile. Subhanallah, with a smile. Nobody knew anything, which is another thing that I want to debunk right now, that I want us to hold on to. Silence is not wisdom, oh, and silence is not a virtue. Real wisdom, real virtue lies in who you are telling your stories to, who you are communicating to. That is where the wisdom really is. It is not in, I don't tell people anything. I'm the kind of person that keeps to myself. And this applies to anything in this life that you want to attain success in. I'm the kind of person that wants to achieve success in everything in life. As a wife, I want to be the best wife I can be. Did you say I said I can be? It's not dependent on other people. I can be. As a mom, I want to be the best mom I could ever be. As a professional, I want to be that person that they keep on calling because nobody can do it like I can, or because there is a way that I do my thing that they prefer. That level of excellence, dotting those I's and crossing the T's. If you are the kind of person that wants to live your life like this, you will face situations that will shake you. And you need to have people in your corner that you can confide in, people that you can talk to. It is not a virtue. Silence is not a virtue when you are going through difficult times. The real virtue lies in, who am I talking to? And how do you know that these people are well equipped to listen? One, how do they talk on normal days, on a normal basis? Are they the kind of people that trivialize everything? Are they people that are calm? Are they people that will make it about them? You will go to greet people, deceased people, families of deceased sometimes, and you will have people crying more than the bereaved instead of comforting the bereaved. Those are not people you want to share your struggles with. You want people that keep you sane, that keep you safe, that still allow space for you to express yourself without downplaying what you are going through. And you need to be able to identify these things before you are in the heat of the moment, before you get stuck in, you know, mental wellness issues, before you are incapacitated. You need to be able to identify those people. So when you're looking for friends or you are seeking to connect, network with people, those are people you want to have in your corner. Another thing I want to say about these knowing who to talk to. One of my clients, I've had medical doctors reach out to me as clients. These are not people that do not have people around, but because they don't want to share their struggles with their close friends and family. They don't want their story to become gist. They don't want their struggles to become what we sit down and talk over. So they would rather seek and reach out to a professional for proper guidance and counseling. So the people are going as far as paying to get the support that they need. They're not waiting, you know, to be remanded in a hospital when they are so overwhelmed and burnt out. They are taking active steps to seek the support they need. So there is no limit to seeking help. There is no limit to speaking out. That is where true wisdom lies. She did not speak up. She did not speak. And if she spoke to people, as it would be, it did not work because nobody knew anything. Nobody. Everybody was in shock. And so we could not offer support. We could not offer help. There were medical practitioners that, if you are in that kind of situation, you could have reached out to as a medical student. They could have, been more lenient on her as regards assignments and projects and things like that. There were so many ways, and I'm saying this too, especially if we have students on board. If you have struggles, identify key people in your school that you can reach out to for support, that you can talk to them about. It's not all about financial support. Sometimes it's about, oh, this person has this issue, so it's okay if the assignment comes in late. Oh, this person has this issue, so it's okay if our project is a bit, they will put that into consideration. But if they do not know, they cannot step in. I did not know that we had a psychologist attached to students in my class, in my school, until I was dragged there when I broke down. And my breakdown was not like, oh, I was just crying for no reason. I was just crying. And I did not have a reason for crying. And I was thinking that was the first time I realized that the school actually provided resources. And when I'm talking about school, we need to look into how, as a society, we create support systems that actually help us to navigate when we have mental wellness issues. So, what do I mean? Schools that have guidance counseling available, schools that have sociology, what am I saying? Psychologists, institutions that allow room for those who are mentally handicapped to do what they can within their capacity. So a lot of these systems are already in place for the physically handicapped or people with physical illnesses, but mental health is not even acknowledged enough in Nigeria. So unfortunately, we still have a long way to go in that regard. A long way to go. But we will get there as long as conversations like these keep on happening. Individually, on an individual level, you want to continue to participate in conversations like these. You want to speak up. You want to be an advocate. Like I believe it was there was somebody that mentioned that an advocate here. You want to do things like that, and you want to equip yourself with the skills to handle when people come on board and they share with you. So with if you have issues, if you've identified a pattern, if you are concerned about a particular thing, whether it is your sleeping, your eating, whatever it is, your behavior, maybe your friends are complaining. A lot of times the feedback will be from those around you. Listen and take to it. So if you've identified that you need help or you need support, you can approach any hospital and seek to talk to a psychologist. They will direct you accordingly. Even if they do not have one, there are referral services. They will tell you where to go. And there are so many free platforms. I charge to, engage with people, but there are free platforms, so many of them. And there are some that are even 24/7. It doesn't matter when you come up or when you have the problem. There's always somebody that is on ground to help for free. So even your finances at this point, there are people who are making sure that finances are not a barrier to seeking proper mental well-being. Okay. So let me just mention, to round it off, I'm going to mention little ways that you can know if you are stressed, because it is when you catch it when you are highly stressed that it can now not deteriorate into other, severe forms. So one of it is constant fatigue. If you're the kind of person that is always tired, no matter how many times you sleep, no matter how much rest you take, you are always tired. You're always saying, I'm tired, though, I'm tired. That is a way to know. If you catch yourself always saying it, that's the sign that you need to slow down. You need to slow down. Another one is irritability or mood swings. Like I said earlier, if you're the kind of person that people just say, oh, she always has mood swings or she's always cranky. That's not a way to be, and that is not a character flaw. That could be a sign that you need to pay attention to your mental health. You need to slow down. You need to take things easy. If you're having difficulty concentrating, this is another big one. At work, during meetings, you're always the one that they're saying, ah, you are not paying attention. Things like that. That's the way to know you have difficulty concentrating in class, anywhere. Then if you notice changes in your sleep or appetite, maybe before you used to sleep for a certain number of hours, but now you find it hard to go to sleep, or your appetite has changed. You're either binge eating, you're eating drastically in large proportions. or you're not able to eat at all, or now it's minimal. I know somebody whose mom was going through cancer, who was she had cancer and she was looking to do her surgery. This lady was not with her mom at the time. She was so worried, she was so stressed. She was in school in final year, so she could not go home. She could not sleep for days, as in days. She had to be placed on medication. So life will life, life will be life, and life will come with its own challenges. We just need to ensure that we are well equipped. Do you even know what to do? If you are the kind of person that cannot sleep for 3 days at a stretch because you are going through something, or because maybe it's even exam period and you just cannot sleep, you are so stressed, you just cannot bring yourself to sleep. 3 days you've not slept. What would you do? Would you know that I should go to the hospital? Would you know that I should see a medical doctor so that I can be prescribed something? Would you know that I can look into exercises that can actually help me sleep, exercises I can do, things I can eat? What would you do in that regard? Or would you wait until your system shuts down entirely? That needs to be the difference between you and the person that is not here right now. Being able to know that I have identified patterns, and I'm able to now take care of myself as I need. Okay. So what are the practical ways that you can use to manage your stress? Because again, these that we are people with jobs or with courses that take up a lot of our time, intentionality. We need to just do the best that we can. So how can you minimize stress while you work hard to get all these things done? Number one, break your tasks into smaller steps. That would make it easier for you. Instead of just saying, oh, I need to complete this thing, break it down. Have a notepad. I have a notepad. I use a to-do list all the time. I have lists, I have checklists. Like, I'm always writing. Writing will help you. If you are this kind of person, please write Sue in the chat box. Let me know if you're the kind of person that does everything with a list. Any small thing you brought out to your list, yes. These are my people. Any small thing you brought out a list, you make a list daily, even. And then with check boxes, you can actually just note what you've done as the day goes on. It makes you feel so accomplished at the end of the day, because your brain can trick you into thinking, oh, I've done nothing all day, or I've not been able to achieve much. But when you're able to look over that list, it reinforces in your brain that you've actually gotten a lot done. You understand? So, another thing is prioritizing what truly matters. There's this skill that we sometimes use where it's like you divide the tasks that you want to do, you divide them into important and urgent. Can somebody please help with that in the chat box where you write it? The first one is four. So the first one is important and urgent. The second one is important but not urgent. Important but not urgent. The third one is not important but urgent. Not important but urgent. The last one is not important, not urgent. Not important, not urgent. So you need to know or have this skill. And then when people approach you for things, when you have to do things, you note all those things down. And then you ask yourself, this thing that this person is asking me to do, where does this fit in? So the ones that are very important, important and urgent, you do them immediately, or you delegate them immediately. The one that is important but not urgent. There's a saying that in this case, if you do consistently the things that are not important, the things that are important but not urgent, you will not have many things that are important and urgent. So if you do the things that are important to you consistently as well as you should, they will not become urgent emergencies for you to deal with. Well, this is not always true. Can you hear me?
Yes, we can now.
So, as I was saying, thank you. So, while this is not always true, typically, if you do the things that are important but not urgent consistently enough, they will not spill into things that are important and urgent. So, the things that are important but not urgent, you can always delegate. The things that are um, not important but urgent, you can delegate as well. And the things that are not important and not urgent, you have no business doing at all. Those are ways that you can minimize your energy spills so that you're not wasting time doing things that do not matter. So that, and then you can focus your energy on things that actually do matter. So another one is saying no, which we already mentioned in the beginning, but especially when you are overwhelmed. That is another time when you cannot afford to say yes at all. So learn to say no. Be honest with yourself and with this person that you don't have the capacity to do this thing right now. So what are the habits that you can actually imbibe in on a day to day that would help you? One, you maintain an uninterrupted sleep schedule. It's not that you wake up briefly now, you sleep again. You wake up briefly now. No, try and ensure that your sleep pattern is consistent. So you know you have a time for waking, you have a time for sleeping, and you ensure that you are not interrupting the sleep as much as you can. You're sleeping uninterrupted. Another one is not eating junk food. Try and incorporate healthy meals into what you are eating. So lots of grains, lots of vegetables. It will keep you full. It will help you to perform at maximum levels also. And another one is staying physically active. You cannot undermine what being physically active will do for your mental health. How fit it will keep you in your brain, in your mind, your physical body as well. And then another one is limiting social media, like the overload. There was a time, for example, when there were so many news about war going on, and people were being even more affected than those. Well, I would not say than those that are there, but they were being so affected. You would think that they were the ones that were waking up to being bombed or being shot every day. Empathy is important. We are human beings, and that is how change can happen. And that is how change can be implemented when there's empathy. But empathy should not then spill into you, you know, um, basically just taking up all the emotional turmoil that comes with this thing. You have to be in a good state to be able to do things for those that are actually going through the thing. So if social media is somewhere where you are constantly being, people are showing, sometimes you are not even stressed by your real life. You are being stressed by what you are constantly exposed to on social media. See some marriages, for example, your marriage is good, but you're always consuming content about people whose marriages are very horrible, horrible stories about men and women, or your place of work. Maybe you are in Nigeria like everybody else, but you have a better financial situation than most people. But you're always consuming content about those whose bosses are horrible and this and that. It starts to affect you. Okay, so you need to limit that as well. Curate your space, your environment, the people that are in it, and the things that you consume to only improve your mental health, to help you maintain a very, very zen atmosphere. Okay, avoid people that bring drama into your life. There are people that have friends that are always bringing one bad news or the other. There is never a good moment with people like that. So you want to minimize interactions with them. So, healthy coping mechanisms for when you are really stressed, like you're really stressed, you feel so overwhelmed. My go-to again is writing. Have a journal, have a book, have a note. Before you are even able to talk to anybody else, you should be able to pour everything that is going on in your brain on paper, in a notes app or something. But always be ready to write down everything that you're going through. Meanwhile, if you ever now need a psychologist or a psychiatrist or a mental health professional, your journals can actually be very good investigative tools. We can go through them together to see where the issues may lie, certain patterns that you may have that may be making you more prone, to being mentally ill or just being distressed in general. So it's actually quite good, even in the long term. And even for you as well, you'll be able to go over it and see where your patterns lie, what you need to do better. Journaling is just amazing, and it gives you that the same feeling you feel, that cathartic feeling when you talk to people or you express your thoughts, what you're going through. Journaling can do that for you as well. You don't have to wait to buy a very overpriced journal. Just get a book, get a notebook or something, and then, write in there, dedicate it to that. And then the next one is the one I spoke about already, which is speaking. Silence is not a virtue when you are going through hell. Open your mouth, share what you're going through with people that you trust that can actually safely contain what it is that you are talking about. Another one is practicing deep breathing. This might seem very, it might seem very oyiboish and just not exactly what we would ordinarily do. But deep breaths will get you through very intense moments. Okay, so you want to practice it. You can watch a YouTube video on how to practice deep breaths. Um, and then engage in your hobbies once in a while. Do things that you actually like. Many of us here, our free time is spent on the phone, scrolling through TikTok, Instagram, or Facebook. Let your hobbies, your free time, let it include going outside, touching grass, seeing, nature. If nature is not your thing, you can go. Yes, so if nature is not your thing, you can do something else that genuinely excites you. It could be going to the movies, whatever it is, but actually engage in activities that leave you feeling very happy, that increase your dopamine levels. So yes. In cases where you also feel highly overwhelmed, you can listen to vocals that feel calming to you. It could be there are sounds online. If you go on YouTube, everything is on YouTube. You go on YouTube, you search for calming vocals. It could be rainfall. It could be the stream. It could be if you're a religious person, it could be listening to, let's say, the Quran. Um yeah, some people even listen to music. There are music that is not very loud and bang, all the time. There are very calming ones. Whatever works for you, basically. Yes. So that brings me to the end of the presentation or the session. I would love for you to, send in questions if you have any, so that we can then explore. Thank you so much for listening.
Thank you so much for the wonderful presentation. Honestly, we were really, really, really glued to it while you were speaking. And to our audience, our participants, you can drop your questions in the chat box so we can treat them. Okay, while waiting for the participants to drop their questions, I would like to ask a question. What role do workplaces, schools, and families actually play in supporting or harming mental well-being? Like, what exactly, like, situations do you think are places of work, are schools or families? What kind of role do they play in supporting or even in harming our mental well-being?
Okay, thank you for that question. I already addressed this briefly during the session, but I'm going to just make a recap and then add one or two things. So let's start with the immediate support system that we typically have, which is, our family, our family. So say your parents, your siblings. In my case, again, back to my own experience, for me, one of the things that really kept me grounded was knowing that I had a home that I could always return to. Yes, everybody says these days when something happens and, people stay, they say there is love at home. So for me, I was blessed with parents that they had a good understanding of what it can entail, mental health and all. So even before my medical, my own doctor was telling me to, leave medical school for a bit, my mom would always tell me right from my first year in uni, she would say, if it gets too much, come back home, or, It's not a do or die affair. If it's going to cost you your mental health, if it's going to make you, going mad, is what we typically say. Come back home, oh, majeki we yeah, anyway, real, that kind of thing. So I had that, and then I was never really, so in that regard, being the kind of people that our people can always return to. Are you the kind of friend that when your friend is experiencing, downfall or experiencing a really bad time, you're very quick to judge, and you're very quick to, somebody is asking how to help somebody going through mental illness. So please listen. That's one of the things that I'm discussing right now. So are you the kind of person that would be very harsh or very dismissive and be like, it's not that deep now? If the person has gone through that thing and is talking to you, it is that deep to them. Your role is not to judge. Your role is to listen and provide a space for them to experience what they're experiencing in a safe way. Do you understand what I'm saying? If somebody is still talking to you, then it's still okay. But when they reach a space where they are not able to communicate their struggles, then we are in trouble. We are in trouble. So in that regard, be the kind of friend, the kind of family that your loved ones are never scared to approach when things go wrong. So that is one that I had that really helped me in that space. For the school institutions, like I mentioned earlier, having professionals on ground that can help students, that can help your workers. One of the services that I offer as a mental wellness practitioner is engaging in employee programs that allow for, you know, one-on-one support when needed. So let's say an employee is going through loss, they can always approach me as long as I've been hired by their institution. Another one is constantly doing workshops for these employees so that they are aware of how to manage their stress, they are aware of diet management, things that can basically just amplify their mental wellness. These are ways that schools can support, that institutions can support, just like Pleyda is doing by bringing professionals on board to speak with, its community members. So these are one of the ways that we can help, which is educating. And also another way that the community can help is having funding available, because we need money for therapy, we need money for medications, and a lot of times people do not want to see a therapist because it's cheaper to go see a movie, or it's cheaper to buy clothes. It's expensive to see a therapist, especially for Nigeria's socioeconomic reality. So if funding is available, we can have more people on board, more professionals on board that are able to see you, because the money is not coming from you, it's coming from bodies. And like I mentioned earlier, we actually have quite a few helplines. So that's another thing to do. If somebody approaches you with mental illnesses, or when they're in a bad shape mentally, is to help them look up online. All you have to do is search. There are so many, numbers that you can call that would speak to you for free and immediately too, and then refer you if needed for more specialized assistance. But you are not without help. And like I mentioned also, so I've basically covered them all, the ways that the school can help. I hope that that covers that. I'm going to go through some of the messages that have been written and try to respond. So how do we help someone going through mental health? Please listen. That's it. Listen. Like, listen to them. When they tell you they are going through rough times, listen to them. You are not their savior. Your role in that situation is not to come and give them money if money is what they lack. I tell my clients all the time, if money is your major stressor right now, I don't have money to give you. If it's children, I don't have children to give you. And I cannot change your children. If it's your spouse, I cannot give you my husband. You know, I am here to support you through this difficulty. That is my major role. That's what most people need. They're not saying I don't want to work. They're not saying I don't want money anymore. They are saying, how can I get support to see me through all the activities, all the things that I need to do to get this job done? That's all they're asking for. If you remember that, they're not asking you to be their savior. They're not asking you to come and just make things easier for them. They're just asking for your support. That makes it easier. Then in terms of, don't judge them. That's another way. That's another thing to put into perspective. Don't be like, even this person that went through that did not do. It's not. You are not there as a judge. You are there as a witness to what they are experiencing. Just keep quiet and be there. Keep quiet. Hold them if they are open to that, but just be a safe space. And part of being a safe space for them is by not judging them or making them feel worse than they already do. There is nothing you want to say that they do not already know. So your first step is to just make sure that they feel safe enough to talk to you, because they know you are not going to. And then remember that this is their life. It's not just, it's not just. If I confide in you and tell you something I'm going through, and then I hear it from someone else, I'm never coming back to you. So you want to ensure that these are things that you want into perspective, and you see it as a privilege when somebody chooses you to support them through what they are going through. So my social media handles, I'm Dr. underscore Rahma Omole everywhere. I'm currently not on Instagram, but and even Facebook, but I'm on TikTok actually. My Instagram account is currently going through a lot. So it's currently on hold for now, but you can reach out to me via TikTok. And you can also get I need to type in my phone number in the comment, in the chat box. Yes, you can have a one-on-one session with me. When you reach out, someone is going to send you a link for booking, and then we can have a session together. How do you handle heartbreak? Okay, well, the way you handle every other thing, like I mentioned earlier, that's why I said everybody, there's nobody that cannot go through mental health struggles, because it could be heartbreak for you that would cause you to break down. And for somebody, it could be failing their examinations. It could be losing their jobs. It could be losing a loved one. The formula is still the same, all the things that I had mentioned before. And if you identify that none of these things are helping, or you are not in a state where you can practice any of these things, help, reach out for support. Like I mentioned, I will put my number in the chat box. Um, how to help someone going through mental illness, I've mentioned that. Another thing I forgot to mention, which is very important in helping people that are going through mental illness, is when you identify certain habits, certain traits that can harm them and others, please refer them to professional sources that did not come to me on their own. Their sister recommended them. Their daughter brought them. Their mom brought them. You understand? So when I first saw a psychologist, the first professional I saw, a friend dragged me there. She just took my hand and took me there. The time when I mentioned I was just crying for no reason. So sometimes for people who are going through such difficult moments, the first thing on their mind is not seeing a doctor. It is those around that can see clearly without prejudice, that can see that this person actually needs support. And I cannot provide the support that they need. You understand? I'm not in a position to provide this support. They need professional support, and then they get it for them. Wives, book sessions for their husbands, and husbands do the same for their wives. And when we talk about supporting those with mental illnesses, this thing is, as long as you have genuine affection for them, there is no length that you cannot go through. One of my major concerns when I was seeing that psychiatrist, the first time I told you I went to a clinic, was that will I get a spouse? Will I ever get a spouse with my mental health issues? And the lady laughed. Meanwhile, again, who you speak to matters. One of the psychiatrists had told me never to divulge my medical history with anybody I am seeing until, maybe we have some days to the wedding or something, for my peace of mind, so that they will not run away or something. And this lady, this other I saw, kept on saying professionals until I found one that I genuinely, I just felt more comfortable with her. And she told me, she said, there are spouses that they are the ones that bring their significant others to the hospital. They are the ones that come for their drugs every month. Imagine, you're not the one with the illness. You are the one coming to get your wife's medications, your wife's drugs. Can you imagine that level of love, that level of support? So the ways you can support are numerous. It could be keeping your mouth shut and not The story is not yours to tell. Their pain is not yours to share. It could be that. You can support in so many ways. I had friends because there were times when I would isolate myself. That time I would isolate myself and they would not see me for days. One of my friends told me when I eventually got out of that state, she told me that one way that she still supported me, I guess, from afar was checking every morning to see if my lights came on and checking every night to see if it went off. She knew I couldn't sleep with the lights on, so I most likely would switch off the lights. And actually, at that time, it was quite the opposite because I was only very active at night. But for whatever reason, she just kept on checking daily to ensure that the lights came on or off. Imagine that kind of intentionality in just trying to see that, okay, my friend cannot be my friend right now because she's in a really bad state. But how can I ensure that she's actually safe, where she is? So there's no limits to what she can do. I had those that would bring me food, by the way. They would not talk, they would just leave it at my doorstep. I think that they would not talk, they would just leave it at my doorstep, so that I would get something to eat. So there's no limit to how you can support people that are going through things. If you remember that it's not about me, it's about this person. It's not about me, it's about this person, and then how can I support them? Um, how can mental health advocates set healthy boundaries during their downtime and still respond compassionately when someone reaches out for help? Again, for boundaries, the first one is no. That's the first step to maintaining a healthy boundary. My psychologists over the years, as professionals, and as clients, they keep the best boundaries I know. They are not scared to say no. And when you cannot reach them, you cannot reach them. They have given you resources, they have given you tools, they have given you referral paths that you can take. But they will not be available when they are not available. Because again, even as healthcare practitioners, as mental wellness advocates, you have to advocate for yourself. You are your number one client. You need to take good care of yourself. So say no, let people know you will not be available past certain times. I have people reach out to me at ungodly times and I have to redirect them. Let them know they have to go through bookings. There are times that I do not work. I have to take care of me as well. Understanding the fact that you are not a savior. When you have a savior mentality is when you believe that if you are not always available, people will not be fine. You can only give as much as you can. Once you acknowledge that, it becomes easier for you to put boundaries in place. I was supposed to have a meeting, another program like this evening. I'm currently traveling, by the way. And I had to let them know that it will not be possible because I do need to create time for, my spouse. So you should not be scared to say no and trust that these people are adults as well. A solution will come, and you are not alone in this. This is why we need more people advocating, more people willing to support, so that those that are already in it will not get overwhelmed. The burden is large for those that are present, but you have to take good care of yourself. And when people find relief, they will always come to meet you. So you have to be the one. Okay, you have to be the one to put the boundaries in place. Um, can overthinking affect someone mentally, or can it cause any mental illness? Overthinking, we would call it rumination. Rumination in biology is basically when let's say a goat, for example, keeps on chewing its food. It even stores it somewhere in the mouth and still keeps on chewing for a long time. And in the mental wellness space, ruminating is basically going over something over and over and over again. It can affect you mentally, and it actually is a symptom that you are going through a mental distress. You are mentally distressed. So it can be a symptom and it can be a cause as well. So when Yoruba say "ironu oda," or when you basically just overthinking is not the way to go. Overthinking is not the way to go. So in this regard, when you are overthinking, for example, write what you are overthinking, write it down, and sit with it, really explore. And these are the reasons why professionals are so important. Why therapy is not just talking. So we sit down with these things, we explore all the, all the things that are involved in what you are thinking about, all the patterns that are in it, and then we break it down such that you are not ruminating anymore. So, yes, that's the response to that. Is having too much energy a mental issue that needs attention? There are mental health conditions that actually have being hyper or having too much energy as a symptom. Even in children, there are hyperactive disorders. You need to see a professional and get diagnosed. So you go through the proper channels, they really check. There are checkpoints, there are questions they would ask you, there are things that they would explore and then get back to you on whether you have, a hyperactive diagnosis or not. um is not interested in anything at all a sign of mental illness? Well, we would have to explore that a lot more. We would have to explore that. Like I said, speaking to a professional, it's not enough to just ask a very broad question so that you don't get diagnosed wrongly. They need to sit with you and explore that things. I'm going to input my number now. Someone was raising their hand. Please go ahead.
No. Okay. So thank you so much for the wonderful questions, honestly. So my question, I have two questions generally. Please can you hear me? Hello, please, am I audible?
Yes, you are.
Yes, you are.
Okay. So my first question is that for a mental health advocate, so what are the resources, tools, or books that you can recommend for us? So like to study from or to learn from, like even courses to take to know more about listening and supporting people. So the second one is that how you can use like share us some of the opportunities that we can search to get fundings, uh, donors and others. So that I have two questions basically. How can like choose materials and books? The second one is how can we like get opportunity to gather funds to keep advocating for mental health? Thank you.
Okay, thank you so much for this question. I'm writing something right now. I've just sent it to the chat box. Please let me know if you've seen what I sent. I sent my details and I sent a website address.
Yes, ma. Yes, ma. We have seen
Yes.
it, ma.
Okay, thank you so much. So, um, for the first, for the first question, what are the courses that we can take? What are the tools that we need? How can we equip ourselves with knowledge, as mental health advocates? This is very important, and I'm so thankful for this question because when we do not have the right knowledge or skills, you might end up doing more harm than good. A lot of times people have to see mental health practitioners multiple times and different ones before they finally find one that is actually well equipped to do the work. Okay, so in response to that question, I sent this website because it's a free one where you can actually go, you can just type in mental health and you see so many courses. Some of us, you take sociology courses, courses, medical courses that expose you to common mental health issues and just help you to be aware of these things. But if you take certain courses that do not allow you exposure to that, websites like these help you to take mini courses that then give you insight on these conditions. If you type in mental health, I'm sure that so many other options will pop up. And so many mental health advocates that focus on things like drugs, addiction. Some focus on depression and anxiety. Some focus on the well-being of pregnant women. Whatever it is that you are excited to advocate on, I'm sure that you will get resources there. And then there are general courses that you can take that would help any advocate in general, whether it's mental health or not. Another thing that you can do, like I did, for example, was look out to or reach out to other psychologists, psychiatrists, mental wellness practitioners, especially in the Nigerian space, that already have courses, lay courses. We call them lay courses. So you become a lay counselor, which means that at a basic level, you can offer counseling support to anybody that reaches out to you. You're also armed with the skills or equipped with the skills to make the necessary referrals when needed. So you're able to de-escalate emergency situations and refer to the appropriate channels where needed. So this is really beautiful that you are asking. There are lay courses that cost between 30,000 naira to 50,000 naira. You also get certifications. I'm going to mention practitioners that I know offer those courses. Even if they're not currently offering them, they would be able to tell you the next time that the courses would be available. Another reason why I love these courses or I advocate for these courses is because it actually is tied to our ecosystem. You understand? It is adapted to suit our ecosystem, and they also bring international professionals on board to educate. So I'm going to mention, maybe you already know. Let me see, Dr. Aisha Adams. Um, then there's also this man, Mentor Mo. Yes, I believe his name is Mentor Mo, at least on Instagram. If you check these two on Instagram, Mentor Mo especially constantly, consistently hosts workshops, physical programs in Lagos for therapists, counselors, mental health advocates that are willing to learn more. And I think his courses are actually quite cheap, by the way. And I've listened to him speak a couple of times, and he's quite brilliant. Dr. Aisha Adams also has a counseling program, like a training program for interested lay counselors and mental health advocates. So you can check them out as well. And as for receiving funding, I believe that you have to be well established to gain access to such opportunities. You have to be well established to gain access to such opportunities. So maybe join an organization that is already well funded so that you're not getting paid per client, you're getting your payment from who you're working under. Another way is start something of your own. When I say well established, all you might need is a business name that is registered. What else again? There you can just look into or get a lawyer to help you set these things up. It might not be as it's things guide you through setting up a legit setup that institutions be willing to invest in. Yeah, Bingo. Thank you. So again, even when you have programs like these, there are organizations, corporations that are willing to fund the program. So maybe they're not funding your entire or bankrolling your entire operation, but when you have programs like these, especially physical ones, MTN, Coca-Cola, there are so many corporations that are willing to take up these kinds of conversations on and pay for them, fund them as part of their corporate so is it corporate social responsibilities. So yes, you might want to look into that as well. um yes, I believe that that covers everything, unless there's somebody else with another question. And thank you so much, by the way, for bearing with me all the background noise.
Thank you so much, Ma, for the wonderful session. That has been really, really educating, inciting, and I'm sure we've all gained a lot. Silence is not a virtue when you are going through difficult times. So the real virtue actually lies in who you are telling your stories to. And it is quite very important that you do not talk to people that will downplay what you are going through. Speak up. Even if everyone thinks it's normal, speak up, speak to the right people, get the right help, and she has also equipped us with the necessary coping mechanisms. Very importantly is writing, journaling, put down whatever it is you are going through, prioritize what really matters. And for the prioritization, she has given us about 4 different skills: important and urgent. Those are the ones that we know that, oh, you really have to do them. Important but not urgent, you can delegate it. Not important, not but urgent, but you can also delegate it. And then lastly, not important and not urgent, you really do not have business doing this. All of this has really helped shaped what we know and what we think of what mental health entails. And then in a world full of so many pressures, we are now properly equipped with how to manage our mental health, how to deal with our day-to-day activities to ensure that we are in the right position to do what is expected of us and to also be able to help people around us. Thank you so much for the wonderful session. And to cap it all, I would like to invite the Chairman Board of Trustees, Pleyda Youth Enlightenment Forum, Mr. Olawuyi Ibrahim, to give us a closing remark.
Okay, thank you, moderator. I want to believe I'm audible enough. Can you hear me clearly?
Yes, we can.
Okay, thank you. Esteemed participants, members of Pleyda, and our respected guest speaker, good day to you all. As we come to the end of this impactful health webinar, I give thanks to Almighty God for the success of today's program. So on behalf of the Board of Trustees, I sincerely appreciate everyone who joined us for this enlightening session. Today's webinar has been both educative and timely, addressing issues that concern our health and overall well-being. Our special appreciation goes to Dr. Rahmat Folashade for taking us through this important and timely topic with great insight and professionalism. Your presentation has enriched us with valuable knowledge, and we are truly grateful for your time and commitment. Permit me to say a few words about Pleyda. Pleyda is a development-oriented organization committed to the growth, welfare, enlightenment, and empowerment of its members and the larger society. Beyond being an association, Pleyda stands as a family united by shared values and service, unity, and community development. We are particularly grateful that Pleyda is celebrating 10 years of existence, a decade of impact, brotherhood, growth, and service to humanity. Over these 10 years, we have continued to promote meaningful initiatives in education, health awareness, youth development, community progress, and this health webinar is another reflection of that commitment. Yes, you can also testify to that. Our unique strength of Pleyda is the diversity of professionals and discipline represented among our members. Because of this rich diversity, our members are organized into 5 professional clusters. Based on this respective field of their studies, yes, namely finance, tech, health, arts, entrepreneur. And you agree with me that our previous webinar is mostly centered on those that are on the field of finance, like accounting students or someone studying course related to finance. And coming up with this, because most of our participants may be wondering that why are we having health seminar? It is because we have 5 clusters, of which out of the cluster we have the one that is mostly concerned about health, that involves students that study health-related course, like medicine and surgery, nursing, and the like. So they always come together under Pleyda as an umbrella body to organize a program to benefit the public, just like the way we have it for finance. So don't be surprised if in our subsequent webinar program, if you are coming up with another program that also focus on other field. So that is what I'm just trying to prepare our mind for. So to cap it all our participants, thank you for your presence, contribution, and active participation. Your engagement has made this program worthwhile. So as we close, I encourage us all to put this into practice, the lesson learned today, and continue to support the noble ideas of programs of Pleyda as we all look forward to even greater accomplishments in the years ahead. So thank you, and I pray to God Almighty to continue to enrich us in more knowledge, wisdom, and understanding. Once again, I say a big thank you to our guest speaker. Thank you. Have a wonderful day ahead. Bye.
Thank you so much, sir. Once again, thank you so much, Dr. Rahma. We are really, really, really grateful. I pray that may you continue to excel in your profession, and may God Almighty continue to use you as a tool to help others. It is also important to note that this session has been recorded and it will be shared on our YouTube page. The link will also be shared with participants that registered via the mail. Thank you so much for joining. Conclusively, Pleyda, productivity our watchword, productivity our watchword, Pleyda. Thank you all for joining. We can now begin to leave.